22-year-old Danielle Mezzanotte is devastated when, after 8 weeks of non-stop vomiting and 2 surgeries, doctors tell her there is nothing more they can do to help her and send her on her way.
I was in disbelief. I was like, how can you turn someone away?
Danielle refuses to give up and instead travels 30 miles to Yale University Hospital, hopeful that the doctors there will be able to put an end to the nightmare.
They were concerned right away because I did have a PICC line, so they knew something had been going on with me. We explained the story, and they were saying, we are going to find out what is wrong with you, and they were just running all kinds of tests.
There, they had a huge team of doctors come in on a regular basis, and they were looking at all kinds of things.
Everything was coming back negative. They weren't finding anything wrong whatsoever.
Danielle's attending physician is stumped. How are all of Danielle's tests coming back with normal results when she's clearly so sick? The physician brings in gastroenterologist Priya Jamadar to take a closer look.
Well, frankly, I wasn't quite sure what was going on. She clearly looked like she'd been through a lot. All her investigations were essentially unremarkable, yet she was in excruciating pain and was clearly very disabled by her symptoms.
After a thorough exam of Danielle and a review of her charts, Dr. Jamadar thinks that despite all the normal tests, the key to Danielle's diagnosis is a structural problem deep in her digestive tract. But he needs to do a special test called an ERCP to take a closer look at her pancreas and the place where her gallbladder used to be.
Vomiting is often a non-specific symptom. There's a lot of possible reasons for that. To make a definitive diagnosis, the best test we currently have is an ERCP.
I was really excited just at the way he was talking to me, that he really wasn't sure if this procedure would work or if it would show anything, but he was really willing to try it.
At 8 a.m. the next day, Dr. Jamadar works an endoscope down Danielle's throat, through her stomach, and down into her duodenum, which is the hollow tube that connects the stomach to the pancreas and bile ducts. A tiny catheter is then passed through the middle of the endoscope and inserted to measure the pressure in the ducts. Dr. Jamadar is shocked when he registers the pressure at the Sphincter of Oddi, a small circular muscle located at the junction of the bile and pancreatic ducts.
Normal basal sphincter of Oddi pressure is a pressure of under 40 millimeters or less of mercury. Danielle's was significantly elevated at 70 millimeters of mercury. She had a Sphincter of Oddi dysfunction.
The Sphincter of Oddi is a one-way valve regulating the flow of fluids from the bile and pancreatic ducts into the bowels. Sphincter of Oddi dysfunction happens when the muscle becomes too tight and the ducts can't drain properly. The ensuing buildup of bile and pancreatic fluid causes tremendous pain, and in Danielle's case, non-stop vomiting.
It was trickier to diagnose Danielle because of her predominant vomiting, and this is somewhat atypical for Sphincter of Oddi dysfunction.
Also complicating Danielle's diagnosis is the fact that this mysterious disorder is relatively rare.
It's really essentially unknown as to what exactly causes dysfunction of the sphincter in one particular patient. It's not seen that often by physicians who perform ERCP. I probably do about 100 Sphincter of Oddi patients a year.
Luckily for Danielle, Sphincter of Oddi dysfunction can be cured right away through a procedure called a sphincterotomy.
Another catheter is inserted into the bile and or pancreatic ducts, and this catheter has a little wire attached to it in the shape of a bow, and electric current applied to this wire, and the sphincter is cut. It's just a 1 centimeter cut that's done internally.
Dr. Jamadar makes the cut, relieving the pressure caused by the tightly wound Sphincter of Oddi, which finally allows the pancreatic and bile ducts to drain. Within a few hours, Danielle is awake and feeling better than she has in months.
The next morning, I woke up and I told her, I don't feel nauseous anymore, Mom, and she just started crying, and I did too.
After the operation, it was like a brick was lifted off of us, because the weight, she looked better, she sounded better, she was more like Danielle.
A few days after the surgery, Danielle is discharged from the hospital. For the first time in 9 weeks, she feels she's home for good.
I wasn't nauseous. I was able to eat. I went back to my life slowly. Having my first real dinner with my family was just the most special thing ever. You take for granted those kind of things.
Danielle actually responded extremely well to the intervention. We hope she'll continue this way.
But had she continued to elude diagnosis, Danielle would have had a very difficult future ahead of her.
We don't think Sphincter of Oddi dysfunction is a life-threatening condition. However, it does cause significant disability.
If I hadn't met Dr. Jamidar, I really believe that I would still be in the hospital. I just felt like it was just one big circle, and I just keep going back and back.
Now, just a year later, Danielle's life is back on track.
Danielle's life today, well, she lives it to the fullest. She has a good time. She's just, doing what she's supposed to do at that age. So she's enjoying day to day.
She's back to Danielle, and she's a lot of fun to be with. So she's back to normal. As I always called her my buddy. Yeah, she's my buddy.
My life today is great. I'm, going out on dates with my boyfriend, doing anything, swimming, anything